section that I think we can be more mindful this time about. Yeah, sorry, I guess we're starting before the recording was actually, this might be useful for people to see. That we can be more mindful about communicating so that we're not duplicating information, and also doing the references in a way where it's not just a number. Maybe leaving it as like more information on the source to make it easier to compile all the references at the end.
I do have a section here to talk about the SharePoint site, and what I'll do is I'll just bring that up, and so we can look at exactly what we're talking about right now. Yeah, I agree with you, because the references was one of the more difficult pieces from last year, because we had to number those, one through, I think we were in the hundreds, and then we had to edit all that, and that was sort of a bit effort consuming. But yeah,
sorry, I didn't mean to jump the gun.
Oh, not at all, not at all. No, I mean, great question, and yeah, I've got that up here. All right, so yeah, it's 4 o'clock. We're actually are recording already. Thank you all for being here. I did want to let you know that Eileen is not going to be here today. She had a conflict, and so, but we did converse a bit about the agenda, and she shared with me items that she wanted to include on the agenda. And so I've added those in here as well. And I'll, of course, will emphasize those parts that she wanted to share. So again, the agenda is in the chat, and you should have received an email by now as well that is both the agenda, and I thought it would be good to include the recommendations from the survey, because Eileen referenced those in her email to me. So that's what the page 2 is in that document. So again, introductions. I know that Eileen always likes to do an icebreaker. I did not have time to think of one, but we do have quite a bit of agenda today, so I'm just going to skip it. I think we know each other pretty doggone well. Dr. Gill, she's the one that I don't see here yet today. Maybe she'll be attending soon. But again, just wanted to start off with an update from the Center for Medical Cannabis and psilocybin now. But first of all, the CPPC survey report, the 2025 version. I know we talked about that a bit at the last meeting. There's a lot of great information in there, and I think a lot could be utilized in the report, but we have not received the clearance to go ahead and share that yet. I would expect it within the next couple days, so you'll probably receive either a link or a link and a version of the report so that you can read through that. Dominic.
Yeah, so good afternoon, everybody. What I just wanted to let you know is the reason what we're just waiting on is they're doing the final reviews of the report. And so until that is completed and we get the approval to be able to post it, we can't do that portion yet. So that's the only reason we haven't shared it. But what I can do is just to sort of show you all just a little bit. And so I'm going to share my screen so you can sort of see a little bit. And again, mind you, little bits of this, and I don't think it's going to be anything major, may change a little bit. But if it does, it's going to be minor wording and formatting, not anything major at all. But it does go through quite a bit of information, especially, in different areas such as driving under the influence, cannabis storage use in the home. And so I just wanted to show you all, in fact, under the driving under the influence, there actually is, a nice little graph that they were able to do to be able to show what people were saying and what they're self-reporting as far as their own driving habits. And they did this not just with regard to cannabis, but they also asked about alcohol and opioids as well, to sort of have that there. And so there's lots of different graphs and data points within the report that actually have this. And I have to tell you, we're chomping at the bit to be able to share it with you, because I think you all are going to look at this and see all the different items and go, okay, this is a lot of really good information. And I think it's going to help you with the different sections to be able to update. So my hope is that we get that final stamp of approval and yes in the next day or two. And as soon as we do, we will send it out to you. So just wanted to let you know and kind of give you all a teaser. Think of this as the 5 o'clock news. I'm going to show you everything right up until the commercial break, and then we're going to cut to it later on. But so just think of it from that standpoint. But there was a lot in the survey and a lot of data that's come out of it, and I think it's going to be very helpful and very valuable. So.
And I'm going to go ahead and jump over B2C, just talking about the update on data streams, because I think that this segues pretty well into that. We saw that there's a section there about driving and safety. And again, I reached out to the contact at DPS. I do have that information. I'll share that with the health educators so that they have that. And I'm just going to share with you, I asked them if I could get the same data that we had requested for last year. And this is all they presented me. I'll just go ahead. I just cut and pasted it to a Word document. They just, here's the breakdown: 130 offenses, speeding and traffic. And again, they didn't really delineate whether this is cannabis related. I think all of these had cannabis in the notes somewhere, but this was distinctly different than the data that they had provided to us last year, where they had more of a breakdown on demographic and age. And I think that we'd used that to show, that it was definitely that 21 to 25 age range that seemed to have the most predilections for violations. And so I re-requested that they provide us at least the similar data that they provided us last year, so that we can have a little bit of a continuity with our information and with our graphs. They're going to take at least a month before they are able to get that, because they pull that from a portal. So again, I think that as we sort of develop these streams, we're going to see what the limitations are. I know that Hallie had been working diligently on the occupational health section, and we had sort of come to the same name and form, and I reached out, and again, because cannabis use isn't a reportable offense, I guess, or reportable, they don't document it. And so there wasn't really any data there from Occ Health to obtain. So again, with regards to the data streams, we'll continue to reach out. I know, Haley, you have been working extreme on this as well. I think that we're just still waiting for some of that data to materialize or to mature to the point to where it can be shared. Did you have anything else, Haley, about data streams that you wanted to share at all?
I think the only update is just very brief that I did reach out to the PRAMS team. So that's the Pregnancy Risk Assessment Monitoring Survey. I always mess that up, but it's something like that. And they should be able to get us data both for 2022 and hopefully 2023 sometime next month. So that'll be really great, because before in our report, it only went to 2021. So we didn't really have data after, sales started. So I think that'll be really nice that we'll have that this time.
Yeah. So, and again, this is, I think we just perhaps write those sections with the expectation of the data. I know it's hard to, predict what it's necessarily going to say, but probably similar to years past. Now, jumping back to the W-9s, Hallie, thanks for submitting your W-9. Selena does have it. And Alan, Selena is working. Oh, we lost Alan. Selena is working on the reimbursement. So again, thank all of those who drove so far to there's Alan. We admit him. So Alan, again, we were just talking about the W-9s, and we do have Selena working very hard on your reimbursement. I just wanted to make mention, though, that in addition to your leave time and return home time, model, make, and year, and license plate number are things that also we need when we submit those. But I'll remind you that someone will remind you that going forward next time we do have a driving opportunity, or when somebody does have to commute. Okay, the SharePoint. So this is what Eleni and I were discussing earlier. Let me go ahead and share again. So if you go to the SharePoint site, you should see the 2024, and this is how we sort of had it categorized last year, where we each had the folders, and then within these was the written information as well as sort of the brainstorming and the articles that went underneath it. I think this worked pretty well. And then here was sort of where we had the unified document where all the pieces were sort of being put together, and then this is what the editors worked from. We don't have that yet for the 2025. If you click on 2025, it's a schedule I was working on, sort of with some dates there, but that's rudimentary at this point. I think we'll put those file folders there, and then we can drag over the information that's been prepared for today's meeting. I know that Hallie had a couple pages with regards to workplace safety, and we can go ahead and plug that in that folder. And then Eleni, whatever you have ready today, we'll create the folder there. Would that work? That template, it should be familiar because we used it last year, but good place to start. Okay. All right, well, I'll work on getting those there so that you can drag that information over. Another thing is website links have been broken. Hallie, you've noticed this the most. I think you've been good to inform me that you can't get access to the old paper or that a link has been broken. I want to let you know that all that's been repaired. Kathy has been working diligently to get that done. Kathy, could you sort of just update them sort of with regards to why some of the links were broken? If you're there.
Yes, I'm here. And are
Okay.
you talking about links to the website or links
Yeah,
to SharePoint?
yeah. A lot of people are having frustration because of links to the website, and I think that was just something that was actually pretty universal, but it's pretty much repaired now.
Yeah, the links weren't working because our web services team was doing some work to create our new psilocybin program website, and it impacted the medical cannabis site since they all fall under the same center for medical cannabis and psilocybin. But yeah, those have all been they're all okay now and working as expected.
So thank you for that update. So yeah, for those of you that were frustrated by running into the link or not being able to get to the paper, you were not crazy. Their links just were not functioning, but they are functioning now. So please feel free to go to the webpage, go to the new medical psilocybin webpage as well, and peruse that should you feel inclined. Next would be Haley, you had shared about the Cannabis Research Conference, and it looked like a very interesting conference. I did go ahead and include here the link to this research conference if anyone's interested. Again, I'm just sharing information about a conference that's there. This isn't requisite or anything, that DOH would be sponsoring per se, but again, that is that's there if you're interested. I believe it's in Denver, if I'm not mistaken, and I want to say, is it September or October?
I think
I hadn't looked.
Portland in October, but I could be wrong.
No,
that might have been when I was looking at the
Denver
old
was
one.
a different one that I was looking at. I think I would agree with you that it's probably Portland and probably a little bit later in the year if they're just putting the information out now. But feel free to take a peek at that. There we go. That's right, it was Portland. Okay. So, and then just with regards to, at the end of the meeting, the in-person meeting, we had mentioned that there were some positions that were opening, and I believe those have closed. One of those positions was for the center medical director. And so the reason that is becoming available is because I'm actually going to be retiring and resigning from this role, and that's going to be pretty effective pretty immediately. But I wanted to let you all know that. So this may be my last meeting with you. However, we have, a wonderful support team here. I think you all saw the minutes that Katie prepared, and those were just amazing and such a wonderful template to help from preparation for this meeting. So Katie, thank you, and she'll be continuing to do that. But again, this will be probably my last meeting with you all, and so I'm just so pleased we have the in-person.
Oh.
Well, that's
and
sort of abrupt, Gary. Is everything okay?
Oh, it's okay. Yeah, no. My spouse, we're going to be moving to Spain. We're going to take this opportunity. So it's not any no, it's a choice between two good options, staying here in Santa Fe and working with a great team. But this was another opportunity that it just seems like the time is prudent to do it. So again, yeah, it's not a bad thing. It's a good thing. And again, as I say, I might still be around. I'm still waiting for the visa. This is something that is not at my control or disposal. So we're sort of in this wait and see. Again, optimistic that we will even be included and not passed over. But I think that we have checked. We feel like we probably qualify. We did all the diligent paperwork, but you never know. So
We're
yeah,
going to miss
before.
you. You've been so much a part of this for what, 3, 4 years now. So
Well,
we
thanks,
should
and
be able to
I'll
go out and have a drink with you at least, or something, cry in our beer.
come to Spain. Well, yeah, we'll have to see about that. I just I think I am still cherishing that we all had the moment together 2 weeks ago. I thought that was really special. It was such a bookend to the whole COVID, to actually be back together in person. So again, thanks to all of you for being there. And again, I think that we've got such a great core that moving forward um, will be easy and will be good. And but thank you all for all that you've done, for your dedication to this committee.
I,
So
I have an idea. Can we get you appointed to the committee so that you could, because you won't be with DOH anymore, right? You have the knowledge, and you'd be a great addition. We just have to be careful what time of the day we have
We
our
schedule our
meetings.
meetings. I
Yeah.
love that idea. That's
I've been
great,
trying
Holly.
to convince Gary to just stay. But no, seriously though, I mean, we have talked about, potential other things. Gary has been such an integral part to all of this really over the last 5 years here with the program. We are really sad to see him go. And, it's going to be difficult to fill your shoes, Gary. But at the same point, I know that we're going to do great work and you are going to go and enjoy Spain and have a wonderful adventure. And so we're not going to stop you from doing that. But I definitely do like the idea of getting you appointed to the committee. So we'll have to talk about that offline. Don't.
and yeah, we have an addition 575544757. Could
Yeah,
you
is that
identify yours?
is that you, Alan?
I
Yeah.
assumed it was Alan. That's why I let him
Okay,
in. Sorry.
that's great. Okay, yeah, I had dinner. Okay, welcome back, Alan. So, well, again, thank you all. And that being said, next addendum item is actually the meeting with Senator Worth. Holly, were you able to meet with Senator Worth? And would you mind sharing how that went?
Sure. Yes, I met with him yesterday. I had a half an hour with him and his executive assistant, I guess, who helps him. And it went fine. I first of all, I did explain I was there as an individual and as his constituent, not on behalf of the Department of Health or whatever. But he was very receptive. He hadn't seen our report. I had added it to the invitation I sent to him to get together. So I had come prepared with just the first 2 pages, the recommendations, because in 30 minutes you can't do a lot. And we went over the recommendations. He had several very practical suggestions. First of all, he recognized that the things that we've talked about from a recommendation perspective made sense, and I didn't hear any pushback from any of those items. He did ask some practical questions. For example, if we want an epidemiologist, is the position in the budget request for 2026. And if not, he said, then we need to actually get it and push for it in 2027. And that obviously wouldn't come from us on the committee. That has to come from the department in some form. He also asked what the cost would be for that position, and I didn't have any idea when I was with him, so I told him I'd try to get back to him. And he suggested that for 2020, for the interim committees are now meeting between now and the interim session that'll be occurring in January, and that if at all possible, we should try to get onto the at least Health and Human Services committees of the House and Senate side. And then he also suggested perhaps he called it the CCJ committee, which is justice. The J is justice. I can't remember what the CC stands for. He said because Senator Cervantes would also be interested in our recommendations and how maybe we can interact with the Justice Department. I emphasize the need that we need to have our departments, whether it's DPS or the OSHA department within Department of Environment or whatever it was, that we had to get more coordination and data development. And he said that just sounds reasonable and would help for what we have. But his main push was that we need to do more, not just to circulate the document, but to promote it. And in that regard, he suggested people on our committee contact their senators and House members and meet with them and talk to them about it so that there's a greater awareness. And that he didn't say the department, but I would interpret it this way. The department needs to work a little bit more on trying to get publicity, if you will, for through the media for what we've done, because otherwise it just doesn't come to the attention of the senators and the House members. And in the last, I don't remember what it was for this last 60-day period, but they got something like 500 or 600 bills. Right now, most of them were throwaway things that were there to. He didn't say this, but as I was observing what was going on during the session, most of them were throwaway bills that probably were introduced to make something nice with some of the constituents who had major issues of this or that. But clearly, this didn't rise, from the bottom of the pile. I'm sure he hadn't read the whole report when I got to see him. In fact, it was pretty clear to me that he wasn't at all familiar with the report. So, we have to do our own legwork here, and the department needs to do the legwork also and make sure this gets into the budget. It didn't sound to me like he would be opposed to a reasonable additional, one full-time equivalent, one FTE, and I didn't have the numbers, but if it's not $500,000, Haley, you could tell us if that's a reasonable number. We just gave you a raise, sorry. But it's relatively trivial in terms of expenses, our recommendations, and we could also do the same. He didn't jump on the lock boxes, but he noted them as he was writing things down. And how much going to be to get, I don't know how many I don't think we even said in our report how many we'd need to stockpile and start handing out. But if we can come up with some assumptions, you get the epidemiologist, you get the lock boxes, and then the other things, most of the other things are related to the resources I think we mostly have already. So especially, except for maybe some more sort of promotional campaigns for pregnancy, around locking things up, about if you're, to the vulnerable populations, as we've talked about them in the past.
I'm gonna
Yeah, so it's really good to hear that Senator Worth has, at least at this point now, looked at it. I can say they all did receive it, and it's
Sure.
the part that you're saying, there's hundreds of bills that they get along with so many thousands of additional documents. And that's part of what I was trying to say in the last couple of meetings is they're not going to have it. And going and having meetings with the representatives is really good. I do know as I've talked with various representatives and senators, sometimes they've said, "Oh yeah, I've seen that." And they may not necessarily know all the details, but they've at least were aware of it. And we have actually brought it up. As to press releases and items like that, we do bring it up to our comms. And then it has to be a department wide, like there's a department wide aspect of it. And this last year, with everything happening with measles, they were focused so much on measles. They were like, it's going to get lost and it's not going to get picked up. And so that was a part of why just this last year they didn't do it. But we're already going to have been talking with our comms because it's switched around a little bit about what else can we potentially get out there. So, for example, we have they're actually doing a blurb about some of the psilocybin items that we've been working on. We've already had a couple of reports. I try, by the way, when I'm meeting with reporters, to throw in a little bit about cannabis because I'm like, we're the Center for Medical Cannabis and Psilocybin. And had a couple of questions, but they didn't show up in the article. But those are things that are definitely items that we actually do. And so the last one I kind of wanted to just sort of mention is, and both Haley and I have put in some information in the chats, but it's for the positions. We've actually requested the positions at various times. It's been as many as 3 positions one year, I think. And then most years it's been 2 that we've requested. And unfortunately, the budget has always gotten reduced. Sometimes it's been at the executive or the governor's level because we have to submit as an executive agency to the governor's office. Sometimes it's actually made it to the legislative body and then has gotten cut down in or reduced in the various committees. This year, we do know that it is going to be very difficult because they're already talking because of things at the federal level that it's essentially going to be, and that we should consider budgets to be flat. However, even with that, we are looking at some other potential ways that we could actually ensure that there is a dedicated epi position. And in fact, I just was speaking, well, emailing, I should say, not speaking, with the bureau chief, Bella. Oh, I can't think of Bella's last name. Haley, what's Bella's last name? Uh,
Yang.
Yang, thank you.
Yeah.
Just earlier today about exactly that and saying, how can we work on this to be able to ensure that we do have a dedicated epi position? So I have a glimmer of hope that we may be able to do that here this next year. But as far as getting it into the budget, it's one of those things that while the senator may say that, oh, it's not a whole lot of money, and we're talking it'd probably be with benefits and everything else. And of course you have to think of space. Like there are aspects people don't ever think about. We're talking about 100 to 150,000 to fully support the position. But the issue there ends up being that then we sometimes just do not, they say, oh, well, that's only one position here, but the department as a whole has asked for 30 positions. And then it ends up they reduce all 30. Or they say, we'll give you 5. And then it becomes the ones that are most pressing and most important. And unfortunately, in many years, that ends up being an actual situation like disease response, like measles and things like that. So nurses and nursing positions, that sort of thing. So we are going to continue to try on it. And I personally appreciate the effort because that gets that information not just from us, because sometimes I feel like I'm talking about this all the time and our needs. And uh, and so having other people also express those is actually very beneficial.
I would think that maybe what we can do after we get the report locked down much better, say after September, is at the meeting after that, talk about how we as committee members who are not in DOH can do some of the lobbying for this. And I say lobbying in a voluntary way, not as professional lobbyists, but I mean, I've done lots of lobbying for policies over the years, and I recognize a lot of the things you've mentioned, Dominic, are key issues of how the government works. So how do you raise this from the bottom of the pile to the top of the pile? Even if it's a relatively minor expenditure, if it's not top of mind, it gets pushed to the side. So maybe that could be a policy discussion that we have in 2 or 3 months.
Yeah, absolutely.
But at the same time, he said we should talk to Linda Lopez from I guess, the House. She's vice chair of the Health and Human Services Committee, and he said he would be happy to make. They'd be happy to make introductions if we needed to call or let them know that this is an important issue that should be looked at. So I think we should take advantage of that and not even wait till September, October. There seems to
There
be
we
an
go.
echo in here.
It's because Alan joined via phone and computer.
Yeah.
So
He's
Okay.
got it muted now. We're good.
Thanks, Alan. But to take advantage of this while it's still in the senator's mind, I have been trying to get a hold of Rena Shapansky also, because I'm also a constituent of hers, and she is, I think, the majority whip in the House, or I don't remember exact title, and I have not been successful yet to get an appointment with her, but I'll keep trying.
Well, to be honest, you are doing exactly the right aspects on that and the right things, because that is how it is. And of course, as part of an executive agency, we serve at the pleasure of the governor, and so we have to follow the governor's directives. So yeah. So thank you.
Who's the liaison between the governor and the Secretary of Health?
The secretary.
So the governor doesn't have sort of a health policy specialist who
Uh,
who bends her ear whenever necessary.
So that is normally correct. And up until January of this last year, it was our current secretary. So when our current secretary got appointed, well, I should say in December this last year, then to my knowledge at least, the position in the governor's office has not actually been filled because it is so late in the term, is my understanding from the politics of it. And the Secretary of Health usually is that individual overall, but that's really where that situation sort of lies at this point.
Would there be any value in trying to get on the secretary's calendar for the members of the committee who are not the appointed members of the committee, I'd say?
I would say once we have the next document.
Because by then we have the next document, but it'll be too late for the 2026 interim session, most likely, right? Because the budgets have already been sent in.
The budgets have already been sent in at this point. So
it's
they
too
were
late now.
due, yeah. But the thing again, as far as from a budgetary standpoint, this next year, quite frankly, I mean, there were aspects that we've already been told, that 6 months ago were definitely on the table and very good likelihood to get funded, that at this point, because of the issues at that higher federal level, that do not expect them. So, so I think at this point, but that doesn't mean there aren't a lot, as you've kind of said, a lot of the recommendations are not going to be financial and don't actually have a financial impetus on them. So I think meeting with the secretary once this new document is done would be really good. And the only reason, again, that we actually didn't this last year was because we had that change in secretaries right at that point, because the previous secretary left right at the end of November. And then our current secretary was just appointed there middle of December.
So the other thing we recognize that sometimes even small things can take 3, 4, 5 years to actually be implemented by or to be approved by the state legislature. And we see that with various health related bills and other things. So it doesn't hurt to try to get on people's schedules now and then reinforce them year by year until we actually either achieve it or we're told go home and leave us alone. So
Well, and what I will say is with our current secretary, one of the first things that will be asked is, well, do you have the updated information? And so that's why I just say, wait until that point when we have it and have that meeting. Or we can even see about getting the schedule, getting on her schedule for shortly after the report is released. Because
Sure.
one of the approval processes is it does have to go through the secretary's office.
Mhm. Right. Well, we should do that then. We should get on the schedule for reasonable time. Okay,
Sure.
well,
We
that's
can,
that's the
and
rest
we
of
can
it from
request
Worth.
that, by the way. Yeah.
So I'll get back
But
to Senator Worth on the estimated budget and the fact that in the past there have been requests for additional epidemiology personnel, but they haven't been fruitful yet. So.
right.
All right. Well, thank you for that update, Holly. And next, I just want to go over again the timeline for the work. This was what was discussed last meeting with regards to, we're already into July, so I went ahead and took June out. But the goal for July was for review existing sections, make new background content recommendations, and then revisions of the language. And then August, teams submit their first drafts. I think that's actually been sort of transitioned a little bit because I think that when we did leave the meeting last week, the goal was that individuals should prepare a rough outline focusing on their assigned sections. And I did talk to Eileen. She's formulated a rough draft for the section she's working on. Hallie, you already wrote, I think completed your section. And I'll be putting that into this SharePoint folder for others to look at and review and a place to maintain it. But with regards to that timeline, do any of the committee members, do you have outlines prepared, any type of documents that are you hitting that metric, that meter with regards to having sort of just a rudimentary outline on your sections at all? Yes and
Like
no?
really rudimentary for
Okay.
two of them. Not the
Okay.
Poison Center one, but I'm thinking that we'll just sort of reiterate a lot of the information that's in the
Yeah.
Poison Center.
And then to tie that in, what Eileen wanted to share was that just to review the 9 recommendations voted upon in the survey, that those were really again the 9 that I put on page 2 of the document there. They're the tier 1 and the tier 2 recommendations. That there's 5 tier 1 and 4 tier 2, and to just really emphasize those tier 1s that are appropriate for your section, and to a lesser extent the tier 2 recommendations. And because of her desire to include that, that's why I put that second page in there. It's a bit detailed with regards to it's more than just the recommendation, it's the recommendation and then who the recommendation was really for. But I think that many of these recommendations apply to many of the different sections, but we'll of course work out the redundancies at a later time. So next is again, I know that we had the dispensary tour. Anybody want to share anything or any reflections about that experience, or has anybody had the opportunity to go to perhaps a lesser renowned dispensary? I think that we were sort of somewhat joking, but also quite serious, talking about, well, what is, sort of the other end of the spectrum dispensary? What type of visit would that be like? Has anybody had any other reflections on that tour? I haven't gone to any since then, so I have nothing to share, but nonetheless, journal article. I don't think we really assigned one last meeting time. I know that we went quite extensive, but I don't think that we actually did do the journal article. I think the goal and focus was going to be to work on the outlines. So Does anybody want to have a journal article for the next meeting, or do you want to reserve maybe the meeting time more for a discussion of paper and themes?
So I wanted to just mention, I found that Dartmouth Medical School has been putting on what they call an echo program that is really quite good. And while it mostly pertains to the workplace issues surrounding cannabis, which I found real interesting, and there's still several more to go, so I may be revising the paper that I sent you, Gary. But I can attach. Can I attach to the chat, say, a PDF? So I'll give you an example. This was their first meeting, which was back in June, which I just found out about this a couple weeks ago. So I just started to watch these. They're every week or every other week now. And they're quite interesting and they're concise. They're 1 hour. Yet today, earlier, for example, they had a session on how do you determine impairment, which would be relevant to certainly all the safety issues that we've been talking about. So I'll attach an example of this. They had one impact of cannabis on the workplace. Well, that's what this whole series is about, impact of cannabis on the workplace. So how do you attach something just with the plus? Is that, no, in the chat here?
Yes, you can drag and drop the file and place it in the chat where it says type a message.
Okay, so this, it won't drop. Let's see, I'll try it again. It just seems it doesn't. I can send it to you separately, and if you can distribute it, that would be fine. There's one. The first one they did was on how the pharmacology in action, and again a lot of concise slides that were pretty good. And for those who are interested in a little bit more of the biochemistry. Oh, yeah, that's probably it. Thanks, Haley. But and you can go to that website and get the slides from the prior conferences. And for those of you who need CME or other CEs, you get an hour for each one you watch anyhow. So it was pretty good today. The former president of ACOM, for example, was on today, American College of Occupational Environmental Medicine, talking about impairment at the workplace and some of the issues associated with it. So.
No, that's fantastic. And the CME they offer for each one?
Yeah, it's 1 credit per, for 1 hour type of thing. So each one was 1 hour and very precisely 1 hour. I'm not sure why it won't drop into the type of message.
Yeah, no, that's the assessing impairment in the workplace. That would be very interesting, especially given some of the cannabis bills that were presented last year. So, okay.
The next one is on the 6th, intervention management of leave, treatment, and reentry into the workplace. That might be something else. I don't know if everybody in their own sections are doing sort of literature searches. It could be just reviews, but there is new stuff since last year that I found that can be useful, and that's a good deal of what I added. For example, ACOM has a new position statement as of a little earlier this year, and that's particularly related to the evidence for the use of cannabis in certain in certain ailments. So.
Yeah, I think that in lieu of the journal article, just watching one of those and getting the CME might be a real productive use of time. I definitely think that impairment one that you watched, I'll probably watch that in the very near future because that's a hot item. And Yeah.
The one thing I don't know, Gary, is if you can get CME if you aren't on the original presentation. So if you just watch it online, I don't know. You may be able to get it. I just haven't inquired yet. So
I think the content is well worth the time, whether there's CME involved or not. CME would just be the icing on the cake. But yeah,
given worth where you're going, maybe you want it in Spanish.
I know I need to practice. So so yeah. All right. So the next would be setting up a meeting date, and I know that the cadence had been about every 2 weeks ago. I'm not so sure if 2 weeks is too soon or if more looking a week, pardon me, a month from now. What, Howie, maybe we'll put this in your wheelhouse since you are the vice chair, and what's your thought on a next meeting date?
Well, if you think in 2 weeks we'd have enough done that it'll be worthwhile, if folks have gotten their first drafts into the SharePoint so that we can review them and discuss them, I think that would be fine on the 6th. I'm going to be in Texas that day, but I can phone in. Alternatively, if we want to wait till, if it has to be a Wednesday, the next 2 and 4 weeks, I'm going to have trouble on both the Wednesdays because I'll be traveling, but it's possible that I can get there in some way. But what about for the rest of you? What do you think is a reasonable time frame, Eleni or Alan? Or
Does it have to be a Wednesday? We were previously meeting. I know later in the week worked better for Eileen.
yeah, I don't know. I don't know what's good for her. We did have them Thursdays a couple times. It's really very episodic from day to day, depending on what's going on. Anybody do you have a preference, Eleni or Alan?
Slightly for Thursday. It doesn't matter as much to me. But if Thursday was worked better for you and better for Eileen, I can't remember why we picked Wednesday this time. Alan, do you remember? Did you have a conflict with Thursdays?
I don't remember.
I think the Wednesday might have been for the tour because travel was more, but I think we could definitely move back to Thursday. I don't think that would be a problematic move at all. That's just my recollection.
Should we look at Thursday the 7th, do you think? Or should we split the difference and do 3 weeks, like mid-August? Like Thursday
3
14th?
weeks would work better for me. I won't be available on the 7th at all, but with the 14th would be fine.
Okay.
Same time or earlier?
I recall that 3 o'clock worked better for somebody than 4 o'clock, but was 4 o'clock, was 4 o'clock better for?
Yeah, I thought we had moved to 3 o'clock for the dispensary component.
Okay.
And then 4 o'clock
for the meeting.
Yeah. So why don't we do that? And there's so few of us that if we need to change it, we could put a doodle poll out or something like that. That would work.
So 4 o'clock on the 14th.
And I'll send Sabrina and Eileen, I'll send that to them, and perhaps if they're like hard nose on that day, maybe we'll open up to a doodle poll. Does that sound?
Oh, Haley, could you do a different time on that day, or
Sure. What are you thinking?
I could do earlier on the 14th. I have a call from 1 to 2:30, but other than that, I'm free basically. Typically my day's over at 4 on Thursday, so that's mainly the thing is I kind of have to move my schedule around.
Can we go to 3? Is 3 o'clock all right for folks?
Yeah, that sounds
Alan.
great.
Or even you want 2:30 then, right? So you can get out of there by 4 if we go an hour and a half.
I mean, if that works for people, but it also doesn't have to be based on me at all. I'm just here for data, so that's not based on me.
Yeah, we can just make sure that Haley's able to present the data early, but Alan's been waiting patiently.
Just that
sorry.
on August 10th through 17th, I'll be on a trip.
Okay.
What about the following week, the 21st or the 19th, or I can't do it on the Wednesday. Or the 22nd. I think you said you like Thursday and Friday, right, Alan?
Those are the 2 days I work. But
Oh,
if
those
we
are-
do it late in the day, I'm okay.
Oh, sorry, I got it backwards then. So how about the 19th, for example?
With
The 19th, Tuesday the 19th.
so the 21st wouldn't work for you, Alan?
Can you do it the 21st, Alan?
Then
I think he froze.
Can you put it in the chat, Alan?
He did say he was having issues with his network earlier.
If the 19th is, I just, I may have to turn my camera off and take care of children periodically, but that's totally fine.
Have them join us.
Yeah, they are valuable contributors to any online meeting, let me tell you.
We will focus on cannabis use among children at that moment.
Would 4 o'clock on the 21st work for you, Alan? You can just nod your head.
yes.
It would. Okay. So why don't we do that for now? And
but then if Haley's Day finishes at 4, would like 3 o'clock
right,
first be better? Sorry.
We can make sure to get data from her in advance. So
how about if we make it 3:30 and then we can get Haley to do her thing and then we can continue. Would that work? All right.
Okay.
Let's say that for now and
3:30 on the 21st.
okay.
All right.
Okay. And just so everybody knows, we will go ahead and we'll get an invitation out to everybody. So
okay, great. Thank you. Well, Gary, thanks again for all of your contributions here. It's been terrific, and we hope you have a great time in Spain. Get to travel around a lot and come back fluent. Maybe you are fluent already. I don't know, but it sounds very exciting.
Well, and again, you're all welcome to visit, so keep that in mind as well. So,
which city will you be in?
Looking for toward Granada, really at this point. It just seems to check a lot of the boxes with regards to just weather and climate, size, and what it has to offer. And in doing research, we've continued to hear great things, and so it actually is just continued to be sort of the top choice. So that's where the initial focus will be. But yeah, still some steps before we get there, but it would be Granada.
Great.
Yeah.
Good town. All right.
We have to do a round of applause. Eileen's not here to prompt it. We have to do a round of applause. Thank you so much.
Thank you all. Yeah, I'll be reaching out to Eileen. I haven't had the chance to share with her yet because we've just been emailing, but we'll be doing that. But thank you all. All right. Well, we are right at the hour. I think that now might be a great time to adjourn unless others have anything they'd like to share or discuss. I've been working at getting those folders. I got the first 4 done. So if you get, if you're having issues with the SharePoint, please make me aware so that we can make sure that you're getting the connectability that you need. But by the end of the, in the near term here, I should have those folders up and then we can start putting those outlines in there. for others to read. All right.
Great. Thank you. Everybody enjoyed the balance of this part of the summer.
Yes, sir.
Thank you, everybody.
Good night.